My opponent states that the do no harm is a quote from the original oath. But one quote from the original oath states, "I will never give a deadly drug to anybody who asks for it, nor will I make a suggestion of this effect." This goes against the original Hippocratic oath that they take today. Doctors address the power to take a life, but not to help people die, but to address the potential abuse of power that comes from the role of a physician. Not only this, but my opponent quotes the Hippocratic oath further, but fails to mention this. A line from the Hippocratic Oath states, "I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can." Using physician-assisted suicide would go against the Hippocratic Oath that many people take today. Not only this, but my opponent also states that life insurance will pay out to the families of people if they take their life or not. I was not referring to life insurance, I was referring to medical insurance. It is important to note that insurance is different, life insurance is different than medical insurance. For example, medical insurance will not treat the illness at all, but it will treat the physician-assisted suicide. Not only this, but official data from the Death with Dignity Act states that 204 patients were prescribed a lethal medication by physicians, but only 133 used the medication to end their lives. When hospice care is properly administered, many people decide not to take the drugs to end their lives prematurely due to the better state of living. It is also important to note that these drugs are out in people's homes and can prove problematic if someone gets their hands on the medication or uses it for intentions other than physician-assisted suicide. Not only this, the New York Alliance states that the witness to a prescription request could be someone who could inherit from the patient. Once the prescription is written, a relative or abusive caregiver can pick it up and give it to the patient in food or drink. Since no witness is required at the time of death, who will know if the patient consented? Furthermore, giving the patients the medicine to administer at home is problematic and can be extremely harmful if it ends up in the hands of the wrong person. According to the official Death with Dignity Act collected from 2016, lethal medication had been given to Oregon patients with less longevity predictability, such as chronic respiratory or cardiac, and even benign and uncertain tumors. The official data from the Death with Dignity Act states that the lethal drug was given to people with an undisclosed longevity. This proves that the opponent's argument that only the people diagnosed with less than 6 months to live will be given the lethal drug is wrong and is already occurring.